Our project is called Beach Exposure and Child Health Study. And the purpose of the project is to understand the risks to children when they play at beaches that are impacted by oil spills. What we do in our project is calculate risks to children, and there is a scientific process by which you can do that. The very first step is to understand your source of contaminant, which in this case would be an oil spill. Then you take a model called a fate and transport model that then describes how that oil spreads in the Gulf of Mexico, for example. From the model, once you know the spread of the chemical, you know the concentrations at where it hit places where people can come in contact. And in our case, we're looking at children at beaches. So we're interested in knowing when it hits the sediments at the beach, what are the concentrations? So once we know the concentrations, our next step is to understand how children play. We need to understand how they play at beaches because if they're in the water, if they're in the sand, if they're digging, they get different exposures. And so we are also documenting how they play in the environment. We have some surveys that we send to the families to get macro activities, which has to do with the number of times they go to the beach, when they go to the beach, how long do they stay, do they eat at the beach, asking about general parameters about exposure. But the heart of the project is to look at the children's micro activities. When they're at the beach, specifically, what do they do? How much time do they spend digging? So we videotape them. And so we videotaped about 120 children for an hour each, and now we're translating that information into numerical models so we can quantify their exposure. So now we can quantify the concentrations, we quantify the behavior of the children that would expose them. Then you take what's called dose. Once you know what they ingest through their behaviors, that's the dose. You can then forecast effect or health risks based on those doses. And we run those models 1 million times. We run it, we take a sample of each of the distributions of the concentration of the child's behavior. We run it 1 million times, and then we get a probability of illness at the end. Well, we've started 1 year of our project, okay. And we're finding that estimating concentrations along the coastline is not easy. We're using a model that was used during DWH that forecasted the spill on the coastline, and we're trying to relate those results to concentration measures along the coast. So we have a relationship between the forecasts and the concentration measures. So there are measurements of concentration already available. There's tons of data that was collected at that time. We're using that data to then put it into the model along with the exposure data to get risk of illness. And we're in the process of doing that right now. We've started with one chemical. We're developing a platform to do those calculations. The vision that drives what we're doing is eventually what we like to see is to have these forecast models that are used to forecast the location of the oil spill, because that's used in response purposes. These models are run automatically. NOAA has a requirement to do that. What we'd like to see in the future is to have these models extended one step further so that we can then estimate risk right away. And so messages can be sent out in terms of what areas should be closed, when areas are open, and it's just to give reassurances to the public right away about the potential health risks along the coast. Yeah, what we'd like to see is that these algorithms that we develop for estimating risk would be integrated in the part of the response efforts. So there would be a group potentially that would take the response from these oil spill projection models and forecast risks right away. So that's how we envision it.